My name is Andrea Trowski, and I'm a registered dental hygienist. I'm a mobile dental hygienist that cleans teeth in people's homes. And in this video today, I want to go through stains on the teeth. So, different types of stains, what causes them. I'm going to talk about pop and coffee stains specifically, how you can avoid them, what's the science behind staining teeth, and why do some people get more stain than others. And it's not just as simple as brushing more to remove those stains. So, I'm going to talk about all of that, including ways you can get rid of the stains at home. Sometimes there's different methods, different types of toothpaste, or even natural methods that can really work well on certain types of stains. So, stains on the teeth, nobody likes them, right? That's probably one of my biggest complaints from any of my clients are why do my teeth stain so much? It's not always cavities being the first concern, it's why are my teeth stained? They could be teenagers, young adults, seniors, and it really depends on what their teeth are, what their teeth look like, and that will really determine the different types of stain that they do have. So, when we're looking at this video here, you'll notice this is a tool we used to clean the teeth. This is kind of like a water scaler, a water pick. And notice the brown and yellow staining here. So, this is a lot more than stain. This is calculus. So, stain happens to the teeth quickly after eating or drinking, and certain things like pop and coffee, which I'm going to talk about, just simply adds more coloring to already weakened enamel. And if you're not brushing thoroughly, that stain has a chance to really seep in, and then you get more plaque, but then you get more calculus, also called tartar. And calculus kind of attracts more stain. Plaque and calculus attracts more stain, where then we have to use a tool like this to really get it off properly. But sometimes you do need a really good teeth cleaning to make it look amazing, right? You can't just brush off already hardened stain. Now, this is typically what it would look like in a real mouth, okay? This video here isn't a real mouth, it's just kind of a video showing you how things can look, right? But this is a real mouth, and if you can imagine, I mean, I talk to patients every day. They say to me, "I don't wanna smile, I don't want people to see my teeth because this stain happens, and it's quite frustrating." The good news is, with the proper teeth cleaning, we can get that stain off for you. I see some clients every 3 months just to remove stain. It's not necessarily because they have a lot of plaque, they have a lot of calculus, it's just the stain. So if you have this, you can't simply brush this off. You do need to get your teeth cleaned, but I'm going to teach you ways to really avoid this after you get the teeth cleaned, but also ways you might be able to get some of this off at home. But first, I wanted to bring to your attention, why do our teeth stain? Like what's the big deal? And specifically, coffee and pop, I'm talking about, coffee, pop, red wine. These are the main things that I see that can really stain teeth. So, like I briefly mentioned before, coffee and pop and red wine, anything that's going to stain your teeth, why does it stain and how does it stain? It's because they have dark pigment in what you're eating or drinking, and that is sticking to your enamel. And if your enamel is in a weakened state to begin with, if you've ever been told you have thin enamel, or maybe you have cold sensitive teeth, that could be a sign of thin enamel. If your enamel isn't very strong, if it's more thin, then that stain can get into those micro cracks of thin enamel. Thicker enamel, stronger enamel doesn't have as many of those micro cracks. So they could be drinking coffee, pop, and no problem, but their teeth won't stain because the stain doesn't have a chance to get into those little cracks. Even if you drink coffee with cream or milk, that can lessen the color. It's not as dark as black coffee, but it can still stain, but it won't stain as much as if you add milk, creamer, almond milk, something like that, but it will still stain. Now, what about pop? Well, coffee and pop and red wine, I probably should have added something here for the red wine too. These things are very acidic. So, in a moment, we're going to briefly talk about the pH scale, where coffee and pop is very acidic. So, it's a lower number on the pH scale. When things are more acidic than your tooth, it's going to cause damage. It's going to thin the enamel with the acidity that's happening. And with that, that coloring is going to attach to the tooth, causing stain. And then it makes it very difficult to remove with toothbrushing because when you're brushing, you're not getting into those layers of the enamel very well. You're only reaching the top layer, but stain is already starting to seep through into that middle layer essentially of the tooth. And that's where having your teeth cleaned can really make a big difference because we have special tools to get right in there safely. So we're not removing enamel, your, outer layer of the tooth at the same time. We're only removing the stain. There are things you can buy on Amazon, those tooth cleaners, teeth cleaners, but they're so dangerous because they're this high powered tool that's basically getting in there and removing the stain, but you could be removing enamel with it. So please be careful. But again, it will remove the stain, but you won't be happy because your teeth are going to be very sore for life now. Because once you take enamel away, you cannot build it back up. There are toothpastes that can help to protect it, and we talk about more about that in a little bit. So basically, in a nutshell, when things are more acidic, plus there's coloring properties in there like pop, soda, coffee, red wine, that's what causes the stain and that's what causes the stain to stick. So I talked a little bit about the pH scale. So right now we're talking about pH and enamel erosion. So enamel is the hardest substance in the body, if you knew that or not, but it is. It's very hard. But once we're eating or drinking things that are acidic, it starts to basically chip away at the hardness of the enamel. And look at this pH scale here. So, neutral, we want the mouth to be neutral. So, we want the mouth to be neutral number 7. But let's say coffee and pop. So, coffee is about a number 5 and pop is a number 2. And did you know to cause a cavity, the pH in your mouth just has to reach 5.5. 7 is what we want the mouth to stay at, but every time we're eating or drinking, the pH scale goes up and down a little bit depending on what we're eating or drinking. Are we drinking water? It's going to stay at neutral. Are we having tea? Tea is actually a little bit more acidic, so we're talking a 3 or 4 perhaps. Or are we having a cheeseburger? So the pH scale is constantly going up and down. But once we have coffee or pop, it's very acidic. So that acidity is starting to eat away basically at our teeth. And then the coloring properties is what's attaching to those teeth. But what you want to do is if you're going to have pop, I tell people to drink it not necessarily all at once, but don't sip it throughout the day or don't sip it over a couple hours because every sip is a new acid attack. You're basically introducing that acid more inside your mouth every time, and that's what's causing the stain. So, those people who might drink a lot of pop, but they drink it quickly, they're not going to have as much stain as somebody who drinks pop and sips it throughout the day. Same with coffee, same with red wine. Now, how can you avoid the stain? How can you really prevent it from happening? Well, I guess first we'll talk about some of the negatives here. I forgot that I had the slide here. But pop and coffee and any drink that's acidic, there are other negatives to it. It's basically if there's sugar in there, pop especially, maybe not coffee because you might not add sugar to your coffee, but it can cause cavities because with the acidity that's happening to the teeth, the enamel is now more exposed and can get a cavity because the sugar is just simply sticking there. It can also cause tooth sensitivity because your enamel is now thin. Thin enamel isn't happy enamel, it's going to be sensitive. It can also impact gum health. So you can get gum disease just by drinking too much pop or any pop because typically if there's more sugar, you're affecting the teeth. If you're affecting the teeth, it's going to start to affect the gums at some point because maybe it hurts to brush in certain areas because you have a cavity from that sugar that you haven't gotten fixed. So if you're not brushing in that area, you're not brushing the gum a little bit as well. If you're not brushing the gum, you can get gum disease. So that's a whole other story for another day. But see how sugar and acidic drinks can really affect the teeth. And of course, talking about staining, your teeth can become yellow. So, not just black or brown stain, but your teeth can actually become yellow overall because thinning enamel exposes the dentin. That's the underlining layer right under enamel that is an off yellow color. So, people's teeth that are slightly yellow, it's because typically their dentin is exposed. but to minimize the damage. So this is important. Drink through a straw. I don't drink coffee through a straw. I don't drink wine through a straw. So that one's not going to happen for most people, depending on what you're drinking. But you can rinse with water right afterwards. Everybody who knows me, in fact, I have a coffee cup right here. I have a coffee and a glass of water with everything or any drink I have. I'm also going to ask for water. Literally, every sip I take, I'm going to have water right after. That is going to limit the acid attacks. It's going to limit the acidity. It's going to limit cavities and staining. So it's perfect because drinking water helps to bring the mouth back up to neutral again. So remember when we talked about the pH scale? As soon as you drink water, your mouth goes back up to neutral. You can't get cavities, you can't get stain if your mouth is at neutral. Now, you can also limit sipping time. So, I talked about this a little bit where if you're sipping slowly, that's going to cause more stain, more problems. But if you drink it a little bit quicker, then it's less time, it's inside the mouth, so less problems basically. And what you may or may not know, you don't want to brush right after you have something acidic because then you're basically brushing the acidity into the teeth. It is suggested to wait at least 30 minutes for your mouth to return back to neutral naturally. Our saliva is going to turn the mouth back to neutral naturally. But if, let's say, you're drinking coffee before work and you want to brush before you leave the house, I suggest having a good swish of water like you're using it as a mouthwash. Have a good swish of water, and then you can brush your teeth right afterwards because you have now neutralized your mouth with the water. But don't brush right after you have an acidic drink or acidic foods. You can also use a better toothpaste. Now, a remineralizing toothpaste, that's hard to say, is what you want. So either something with sodium fluoride or hydroxyapatite or xylitol. So these are all things that help to remineralize the teeth. And what does remineralize mean? It's basically helping to protect the teeth microscopically against any damage. It's not bringing the enamel back fully, but technically it's bringing the enamel back a little bit. So it's just helping to protect. So think of an invisible shield. The right toothpaste, brushing twice a day, actually does cause that invisible shield over the teeth to protect it. That is so important. And get your teeth cleaned on a regular basis. I promise you, you will be so happy. Getting your teeth cleaned often means we can remove that stain for you before it gets worse. The more stain builds up, you can't take it off with your toothbrush, and then we need to spend longer cleaning that off. And sometimes we can't even clean off stain in one teeth cleaning appointment. It has to be done over 2 or 3 appointments because we don't want your teeth to be sensitive. Have you ever left the dental office after a teeth cleaning and you're like, my teeth are so sensitive? That hygienist worked really hard. Like, what the heck? But my teeth are so sensitive. You probably had a lot of buildup, maybe a lot of stain. But what I like to do as a mobile dental hygienist is if I see a lot of stain that I feel would make you sensitive, cleaning it off in one shot, I'm going to separate your appointment into two. So there's no pain, you're more comfortable, and it's easy for me. It's kind of like if you haven't cleaned your oven in 2 years and then you try to do it all in 1 hour. You're going to be scrubbing that oven like crazy. You're going to be working so hard because it comes off in layers. Stain is no different. It comes off in layers. So it's better for both of us if I just take my time, and you will appreciate it so much. But also, teeth whitening. Often it's not talked about, but teeth whitening is an amazing tool after a teeth cleaning. So once the teeth are clean, if you have the teeth whitened, that can actually prevent stain from coming back. Teeth whitening makes the teeth feel really, really smooth because it's kind of cleaning at the same time as whitening with those peroxides. So stain has a harder time to build back up again because the mouth is a nice, smooth surface from the teeth whitening. All of my clients, after they have their teeth whitened, they go, wow, my teeth feel so smooth. I don't know if that's from the cleaning or the teeth whitening, but wow, like they just feel so good. Even if you had your teeth cleaned a month ago and then you have your teeth whitened a month after that, your teeth will feel so smooth, just like that, fresh teeth cleaned, teeth polish feeling. But the whitening can really help to prevent the stain from coming back. So it's pretty neat. Now, that's it, you guys. So let me know if any questions. It can really be that simple. I tell my clients all the time, I don't want you to stop drinking coffee if that's like helping get you through the day, right? But I do tell them I don't love pop. Pop isn't healthy for you. Not that coffee is nutritious, but telling somebody to stop to drink coffee because of teeth stains is not always an easy task. So I tell people drink what you want to drink, but just remember the health standpoint, like pop is not healthy. Pop is There's no nutritional value to pop. There's too much sugar. It's going to stain the teeth. It's way too acidic. You don't want that on your teeth. But coffee, wine even, you can drink it, but there's steps you can take to limit the staining. Brush well, get a proper toothpaste, get your teeth cleaned, and even a little trick that I tell my clients to use at home, and I use this myself, but you have to be careful. So I'm even hesitant to mention this online because you have to be so careful. Is I use a little paste of baking soda and water, and I lightly brush my teeth maybe once a month with the baking soda and water only. But you don't want to do this every day. You don't want to do this even every week because baking soda is very coarse. Baking soda is natural, it's good, but it's very coarse. Our enamel can't handle that much baking soda on our teeth on a daily basis because it's so coarse. But because it's so coarse, it's really good for taking away stains. So I even use that on my teeth once a month because my teeth stain too. I know all the tricks, but guess what I do? I drink green smoothies every day throughout the day. And what I do is before I swallow my green smoothies, I just swoosh it in my mouth. I don't know why. It's a weird habit, but that clearly causes stain. I drink smoothies with a straw, but it doesn't help if you're just going to swish it through your mouth anyway. So if you're like me, where you're drinking a lot of green smoothies, maybe even eating a lot of vegetables, which is healthy for you, but you will get more stain. But drink lots of water, have your teeth cleaned, and that will help to kind of limit those stains on the teeth. So let me know of any questions, you guys. Once again, my name is Andrea Trowski, and I'm a mobile dental hygienist. I am a registered dental hygienist since I was, oh my goodness, I've been a dental professional since I was 19 and I'm almost 40. So I can definitely help to answer any questions you have. And thank you for watching, and I'll see you in the next one.